Hi, today we're going to be talking about the root causes of SIBO. This is Dr. Claudia Bustamante, and this topic is very important because if you have been diagnosed with SIBO and you're not addressing the root cause, there's a high chance you're going to have a SIBO relapse after treatment. So let's start with a brief overview of what is SIBO. SIBO stands for Small Intestinal Bacterial Overgrowth. And we all have some bacteria in our small intestine, although the majority of our gut bacteria is in our large intestine. When there's an overgrowth in the small intestine, and this is usually commensal, and that means regular bacteria that we all have in our small intestines, and opportunistic bacteria. And these are bacteria that, as its name says, they can grow if they have the opportunity. For example, after taking antibiotics, opportunistic bacteria can overgrow in our gut. So it is not an overgrowth of pathogenic bacteria. It's usually commensal and opportunistic bacteria. The gold standard to diagnose SIBO is via endoscopy with aspiration of the intestinal fluid of the small intestine. And when there is more than 1,000 bacteria per ml, that means you have SIBO. And we commonly use lactulose or glucose breath tests for assessing SIBO in practice because it's a much easier and less invasive way to assess for small intestinal bacterial overgrowth. So it's not about the type of bacteria, it's about the number of bacteria. There's an excess of bacteria growing in your small intestines. And I want us to take a pause here and think about what can happen if there is overgrowth of bacteria in the small intestines where we absorb most of our nutrients. So every time we have foods coming to the small intestines, there is going to be fermentation because bacteria ferment. And what do they ferment? They ferment specific types of fibers. Foods that are high in these fermentable fibers are also known as high FODMAPs. For example, onions, garlic, asparagus, chickpeas, bread, and dairy are products that are high in FODMAPs. So usually patients that have SIBO will feel worse after meals, because there's more fermentation of bacteria. And if you have ever done your own fermented foods at home, like kombucha, sauerkraut, or kimchi, you may have noticed that with fermentation, there is a lot of production of gas. So something very similar happens in our intestines. And we have the classic symptoms of SIBO, which are the classic symptoms of fermentation of bacteria, like abdominal bloating and abdominal distension. This is because bacteria produce a lot of gas, and that can cause bloating. There can be abdominal pain. This is usually a low-grade abdominal pain. It can be crampy. There can be gas, belching, and flatulence, mainly from the production of gas of the fermentation of bacteria. There can be diarrhea or loose stools. There can be constipation or mixed bowel movements that alternate between diarrhea and constipation. It will depend on the type of SIBO you may have. And there are three main types of SIBO: hydrogen SIBO, hydrogen sulfide, and methane SIBO. Hydrogen SIBO and hydrogen sulfide are usually correlated with loose stools or diarrhea, and hydrogen sulfide has that very characteristic smell of rotten eggs because of the hydrogen sulfide smell. And methane SIBO is usually correlated with constipation. Going back to the main topic of this presentation, what are the root causes of SIBO? We need to understand, why do we develop SIBO in the first place? And for that, we need to know that SIBO is not normal, and our bodies have their own defense mechanisms against SIBO. And when those fail, we can develop SIBO. So let's talk a little more about that. Our body's first defense mechanism is gastric acid, also known as stomach acid, and bile acids. So both have antimicrobial properties, and they can kill bacteria that is continuously coming from our mouth and from our nose, preventing colonization in our intestines. And let's think for a minute, what can cause low levels of stomach acid? Some common causes are the use of PPIs, chronic stress, autoimmune gastritis, H. pylori infection, and aging. Over time, our body produces less stomach acid. And how about bile acids? So bile acids are produced in the liver. They are stored and concentrated in the gallbladder, and every time we eat fats, our gallbladder releases bile. So bile acids in bile, they go to the small intestine to digest fats, but also to have that antimicrobial effect and prevent the overgrowth of bacteria in the small intestines. Bile acids are 95% of them are reabsorbed back into circulation to the liver. And 5% of them go to the colon, where they are transformed by gut bacteria into secondary bile acids. So any condition that can affect the production, the concentration, and the reabsorption of bile acids can make you more prone to develop SIBO. Some common conditions that can cause low levels of bile acids reaching the small intestine includes cholestasis, and this is when the bile flow is very slow and we get less bile acids in the small intestine, bile acid malabsorption, and this is when we lose some of our bile acids because they are not being reabsorbed in the small intestines, and over time our body produces less bile acids. Having your gallbladder being removed can affect the concentration of bile acids, and having chronic liver disease can affect the production of bile acids. Remember that they are produced in the liver and stored in the gallbladder. So any of these can affect the amount of bile acids that reach the small intestine to have that antimicrobial effect and prevent bacterial overgrowth. The defense mechanism is migrating motor complex. This one is also known as the MMC, or the housekeeper wave, because it helps to sweep out bacteria throughout our intestines, preventing overgrowth. And the way I want you to picture the MMC is like a wave of movement that can help to clear out bacteria and food and help it move throughout the gastrointestinal tract, preventing bacterial overgrowth. When the MMC fails and there's a stagnation of bacteria in the small intestine because we don't have this protective wave of movement throughout our intestines, that can increase the risk of having bacterial overgrowth. And why does the MMC fails? The most common cause is food poisoning. Many of my patients tell me that they started developing abdominal bloating, abdominal pain, diarrhea after having an episode of food poisoning. So very common. Stress can impair the MMC, opioids, definitely, diabetes, scleroderma, hypothyroidism if it's not well managed, Ehlers-Danlos syndrome, all of these can impair the MMC. Something important to mention is that the MMC gets activated when we are fasting. After 90 to 120 minutes of fasting, the MMC gets activated. So it is important to space out meals. I usually recommend my patients to space them between 4 to 5 hours to give time for the MMC to get activated and avoid the snacking in between meals. Third defense mechanism is digestive enzymes or pancreatic enzymes. And these enzymes have actually antimicrobial properties. So if you're not producing enough pancreatic enzymes, you can have an increased risk of having SIBO because there is less of these anti-inflammatory enzymes reaching the small intestine. And there are many causes why our bodies may produce low levels of pancreatic enzymes, like chronic pancreatitis, which can be caused by a high consumption of alcohol, cystic fibrosis, which is a genetic condition, maybe having pancreatic surgery or having a pancreatic tumor or pancreatic cancer can cause it as well. And the way we diagnose it is with a stool test called fecal elastase. So if you are experiencing maybe chronic diarrhea, this can be something to discuss with your provider. Defense mechanism is the ileocecal valve. And this is where the small intestine meets the large intestine. So it is a physical barrier that prevents the migration of colonic bacteria from the large intestine or the colon to the small intestine. Here we have a better picture of the ileocecal valve here. So it's where these two meet. And in patients who may have abdominal surgery, maybe they had part of their terminal ileum being removed, and they also had the ileocecal valve being removed, they have a higher chance of having SIBO. Similarly, when there's a lot of inflammation within the terminal ileum, like in patients with Crohn's disease, the ileocecal valve can be inflamed as well, and that can predispose patients to develop SIBO because it is not working as properly. And then we have low levels of secretory IgA, which can help neutralize bacteria and promote bacteria clearance and help maintain a healthy immune barrier. Patients who are taking some medications like antibiotics, antiepileptics, and some immunosuppressants medications can cause low levels of secretory IgA. In a similar way, patients who have immunodeficiencies like HIV can have low levels of secretory IgA. And it's common also in some autoimmune conditions like celiac disease. Another common cause of SIBO is having structural and anatomic alterations. And this can happen, for example, when patients have abdominal surgery and maybe they had part of their terminal ileum being removed, maybe also their ileocecal valve is being removed and they have less protection against SIBO. But they may also have abdominal adhesions post-surgery, which can impair motility in the small intestine and can make them more prone to develop SIBO. And this is a clear example of anatomic alterations in the small intestine. Here we can see that there is narrowing of some areas in the small intestine, which can impair motility and make you more prone to develop SIBO. Common to see this in patients with Crohn's disease. And these are not defense mechanisms against SIBO. Actually, drugs and some lifestyle factors can make you more prone to develop SIBO. We already talked about PPIs, opioids. Antibiotics is a big one because antibiotics can increase the growth of opportunistic bacteria. Chronic stress can impair the MMC. Frequent meals, as they can also impair the MMC. Remember, we talked about the importance of fasting to activate the MMC. And post-radiation enteropathy. So maybe some patients that have been diagnosed with cancer and they are receiving radiation, abdominal radiation, that can impair motility as well and make you more prone to develop SIBO. So this is a summary table with the main root causes of developing SIBO. And based on this whole presentation, what do you think is the root cause of your SIBO? And you may have more than one. Many times my patients maybe they have low stomach acid because they're taking PPIs, but they may also have a history of abdominal surgery and they have adhesions post-surgery, which can make them more prone to develop SIBO. So hope you enjoyed this presentation, and if you want to learn more about SIBO, you can visit our website.